time you started today?
6. Not too bad. It's late for me. I like to start earlier, yeah.
What time you usually start?
Well, on days I don't have too many cases, just 6, but sometimes 5.
Good morning, everyone. We have Dr. Shane McDaniel with us today. We are really excited, so everybody show him some love, please. All right, don't embarrass me, guys, not today. All right, now we are going to be asking some fun questions with Dr. Shane McDaniel. Let's start with, how are you feeling?
Feel good. It's almost Thanksgiving. It's always fun.
Nice. Are you working for Thanksgiving?
No, Thursday and Friday I won't be here.
Okay, fantastic. Well, guys, the days that he is working, we definitely want to know more. But let's go ahead and start with this. So, what are some frequently asked questions that have been asked, but that should be asked?
Okay, so like at the consultation?
Yes.
Yeah. Okay, so really when I think of the best results I have are patients that are well informed. So people who come with good questions, who have kind of done their homework. And on the flip side of that, a lot of the less favorable outcomes I have are people who aren't prepared for the surgery or the recovery. So one of the most important questions I think people should ask or probably be aware before they get here is, do they know their surgeon, whether it's me or someone else? You need to know, what their work looks like, other patients, their results that they can achieve. You need to know, their training and their complication rates, things like that. You can always ask doctors that. Now, most doctors aren't going to fess up to a lot of the problems they've had, but usually you can also find that information out again on reviews, on other patients and message boards or groups before you get here. When you do get here though, one of the biggest questions is the surgery that I want right for me? And so, we have to figure out what your problem is, because a lot of times, you have a problem and you don't know how to fix it exactly. And that's kind of my job or other surgeons' jobs to help you achieve what you want, if it's achievable. So addressing what your concerns are and then asking the doctor what their opinion is, as opposed to coming in and saying, I need this, because you may not need that in the end. After you've got the surgery kind of figured out, that making sure it's the right one, you need to make sure that you understand what that specific surgery's recovery is all about. Because if you're not prepared for the recovery, your results are not going to be that good, truthfully, because the surgery realistically is the easier part. The recovery is the hard part that really relies on you as the patient to commit to and follow through with, because the swelling will last months. If it's not addressed correctly, then it can cause fibrosis, you can cause seromas, all sorts of things. If you're not following restrictions, you can have hematomas or wound breakdowns, all sorts. So understanding the recovery and what the limitations are also very important.
Sounds good. So guys, post-op is something that we definitely need to be paying attention to. I'm a tattoo girl, okay. Dr. McDaniel, so I agree with this. You can have the best tattoo artist in the world, just like how you can have the best plastic surgeon in the world, but then if you don't do your post-op the way you're supposed to, it definitely ends up like that. Now, what's something else that you would say that they would 100% should ask during the consultations?
Well, there's a little variability and depending on the surgery you're having. So, for example, let's say we're doing a facial surgery, okay? You should ask where your incisions are going to be, or I would if I was you. You want to understand that so you can better understand what to expect after surgery. Because for example, again, with facelifts, there are different types of facelifts. There's a short scar facelift, a neck lift, a full facelift, and neck lift. And so if you come out expecting to have a scar just here behind your ear, and you come out and you have one all the way across or in your hairline, you're not going to be happy about that, and you're going to be worried about what happened to me when I was asleep, So understanding the procedure and what to expect from the scars.
Fantastic. Now, we do have a couple questions, I believe. So we have Faith Leah, who is asking, what's your BMI max?
So 35 is my BMI cutoff. I recommend and encourage you to get that lower if you can, but that's my cutoff. I just think that going higher, you run into risk of wound problems, you run into risk of blood clots and recovery issues. So below that is definitely ideal. And
you did mention, hi Miriam, you did mention that we also should be preparing for the surgery, also for post-op, but what about the preparation for the surgery? What would you recommend?
Yeah, so at least here at Avana, you're going to get a email about a month before surgery that's going to require you to do some things. Lab works, seeing your doctor, any clearances you may need specifically. You want to do that earlier. You don't want to wait till the week before your surgery to get that done because number one, if something comes up that may need to be retested, it could delay your surgery. If something comes up that needs another clearance because your blood pressure is high or there's something on the EKG that we see, then you're going to have to find that clearance before surgery, so it may delay your surgery. The other thing that I really think goes or kind of not discussed much is the mental state. You have to prepare for surgery, not just all surgery, but especially facial surgery. But you're going to go through a recovery process where you're not going to be happy. Because you're going to be swollen, you're going to be bruised, and you're going to be draining or have incisions, and it takes time to see your results. Most results aren't really visible until about 6 to 12 months after surgery. So be prepared and for mentally, and then be prepared also for the recovery.
Fantastic. So we have Mariam that comes on my lives often, and
Hi,
she is
Mariam.
actually booked with you.
Excellent.
And she is going to be doing her BBL.
I can't wait.
Now, I think you did a couple of her family members already.
Okay.
Which is fantastic. And so what would be something that you would say to prepare for other than, definitely mental, because the swelling does have a bit of that body dysmorphia aspect to it, but physical more so.
Let's speak to Miriam, for example, your BBL. Number one, you want to make sure that you're going to be here for at least 5 days for me after surgery. It's very important, and one reason is you're going to have a drain, so that drain is going to come out usually on day 5. It can be longer, but most often day 5. So prepare for a flight not 5 days from when you arrive, because 5 days from your surgery. Don't forget that, because it's usually a day or two before when you get here. The other thing to prepare for is make sure that you have your faja the day of surgery, your foams that I'm going to want you to wear the day of surgery. Make sure that you are not eating after you're told not to. Usually it's about 10 p.m. to midnight the day before. And make sure you're hydrated. There's a misconception that before surgery you shouldn't eat, you should fast for better results. I do not agree with that at all. I actually want you to have a really healthy dinner. I want you to be kind of well nourished before you come in so that your body will be ready to recover. It takes a lot of energy to recover.
Fantastic. So we have a couple other questions for you, Dr. McDaniel. Leslie wants to know, hello, can you tell me the difference between Lipo 360 and Flex Sculpt?
Well, I don't do Flex Sculpt. Lipo 360, you're going to be having more of an invasive procedure all the way around. We're going to remove the fat at a depth layer and more superficially to give you more an anatomical look, kind of more of a sculpted look. And then you can go into other options like high definition liposuction, which really contours the muscles and recreates them well, or ab etching if you want to show more of your six pack or whatnot. In terms of the flex sculpting, I don't want to speak to it because I don't do it. I don't want to misinform anyone, but definitely do your homework. And I will say most non-invasive procedures are not going to achieve the same results of the invasive procedure they're trying to replicate.
And just so everyone's aware, guys, do you remember the image, the video that's on loop always? That's Dr. McDaniel's work. So this is what we're discussing today more so when he's saying the HD lipo, the high definition lipo. Now we have another question by Naya. How long do you have to wait after a C-section to perform a BBL and lipo surgery?
That's a good question. You want to let your body recover. I personally recommend about 9 months because after a C-section or pregnancy in general, you're going to have a lot of edema and swelling in your tissue. And when you come in and we do liposuction, we're removing fat, not edema. So you want to get rid of as much swelling as you can. So when you come in, we can target the fat and remove that to really contour your body better.
Fantastic. And Chrissy actually has a follow-up question, and she wants to know, does it feel like a C-section afterwards? Well, I think that
like a tummy tuck? Yeah, I can't speak exactly to it, but in terms of the incisions, it is comparable, but it's going to be more of a muscle pain and spasm deep because when you have I assume you're speaking about a tummy tuck. When you do a tummy tuck, I repair the muscles underneath all the way up to your rib cage, your xiphoid process. So instead of just a little cut through your muscles here and the fascia, you're going to have irritated muscles all the way along. So that's going to be the main difference. So it may be a similar, sensation, but it's going to be probably more a little bit more painful than that, I would guess.
And we have a first time question actually by Chrissy, and that's, are you experienced with melanated skin? And I just kind of want to follow up with that. Is there a difference?
Yeah, so there's definitely a difference, and there's actually a scale, it's called the Fitzpatrick scale, that you can kind of try to classify different skin pigmentations. It's a little subjective, but the darker your skin is, the more melanin your skin is producing. And the reason that matters for any surgery is that the more trauma your skin encounters, the more melanin can be produced. Sometimes more melanin production can be associated with higher chances of keloiding or thick scars. But this comes really into play when you talk about facial surgery and laser resurfacing or chemical peels, because the more melanin your skin has, the more pigmented it can become, or hypopigmented if those melanin producing cells are damaged and they're not producing. You can get hypo or white scars. So it really stands out. So you have to prepare the skin for those situations. But any damage to the skin can really cause overproduction of that melanin and cause dark spots on the skin, whether it's at the incision or under where liposuction is done.
I also feel like we tend to have a lot more swelling. Is that normal? For a longer period of time?
Melanin or darker melanin? I personally don't know of a correlation. It may be though, you know.
Okay. Well, we have another question by Loving Life. Where would you perform J-plasma while doing a mommy makeover?
So really, again, like I talked about before, the consults, it depends what you need and what your complaints are, right? So I think of, in the abdomen specifically, J-plasma, if you're doing a tummy tuck, J-plasma is trying to achieve the same results as the tummy tuck. So you don't need J-plasma there. You need J-plasma if you're doing Lipo 360 in combination with the tummy tuck. And so if you have any loose skin in the waist, the back, that's where we can do it at the same time as a tummy tuck. But you don't need to do it in the tummy tuck because we're going to tighten that skin by removing the excess skin. But yeah.
How can you describe J-plasma for someone like me that has no idea?
So for Lily, can you hand me that probe?
I had it explained to me by Dr. McDaniel, like a fifth grader.
Probe right there.
But I'd love to have it on camera so that those of us who needed to learn and don't have access to plastic surgeons.
So this is J-plasma. It's a company called Renuvian. It's a technology that has helium that will flow out. It will spark and heat the skin up very quickly to over 80 degrees Celsius and then immediately cool. So the point of that, and the reason I bring it up, is because you have to do liposuction with J-plasma because it's the liposuction creates the tunnels that then I use this probe to really treat the skin. So liposuction treats fat, J-plasma treats skin. To break it down and kind of it's not the same mechanism, but think about if you heat plastic, how it contracts and shrinks. That's the entire concept. So you're trying to heat it from underneath, and what you're really shrinking is the fibroceptal network underneath the skin that's kind of loose after you've gained weight. We're going to empty all the fat out of that layer, and then you've got kind of a loose tissue, and it's going to shrink that layer down to tighten everything.
Fantastic. Well, thank you so very much. I believe we have answered all of your questions here on the live. Excellent. Do you have any final thoughts that you'd like to share? Something interesting perhaps about you that we don't know? As a plastic surgeon, obviously not your personal life.
Well, unfortunately, my personal life kind of revolves around plastic surgery, as my wife will tell you. But really, I think a lot of people view Ivana and don't realize we do a lot of facial surgery here because it's a lot of body surgery as well. But it's very important to know there's not all doctors here do it, but the ones who do it do all of it here. And we do a good amount. I think that we all do a pretty good job. I know that myself, Dr. McDaniel, Dr. Golio, I think there's a couple newer doctors that I don't know personally, but I believe some of them do as well. But what's important for that or any surgery is reach out to the Ivana or to the doctor specifically on their Instagram or their social media platform and have a consultation. Because like I've said multiple times in these, there's no perfect surgery that kind of works for everyone. You need to have a tailored surgery for you and your body.
Fantastic. Well, we can't top that. So thank you so very much, Dr. McDaniel, for being here today. And we are looking forward to seeing you guys on my next live. Thank you for not embarrassing you guys. I will see you guys soon.